It is now absolutely conclusive that breastfeeding is best for a baby for an innumerable number of reasons. We know that there's lower allergies, lower asthma, lower diabetes, but also on the mom side, they seem to be able to get back to their pre-birth weight quicker. There's actually evidence that a woman who breastfeeds, especially if they breastfeed for a few years, increase incidences of breast cancer. We actually know that babies' IQ points seem to be a few points higher if they're getting breast milk as well. Their immune systems are being much better set. The secretory IgA, which is the antibodies that we naturally have on the lining of our intestines, are also in breast milk, so they're getting that initially. And one of the coolest things about breastfeeding is that within 4 hours of a mom being exposed to any kind of virus or bacteria, she's putting the antibodies into her breast milk in order to protect the baby. And that's the reason why so often breastfed babies are the ones who get sick the least in the household. Everybody else gets sick, but the breastfed baby doesn't. And that's continuously happening for as long as a woman's breastfeeding. Even if a woman's only breastfeeding a couple times a day, the baby is still getting those antibodies. And even more amazing is somehow or another the woman's body knows that after she's been nursing for about a year, that the percentage of antibodies in the breast milk, the concentration actually starts to go up. So it's like the body just inherently knows that I now have a baby who's walking around, who's getting into more things, coming in interaction with more people, and so I better have more antibodies out there to protect my baby. And obviously, although formula, which has been designed to be more and more close to what breast milk is, thankfully it now has omega-3 fatty acids, the protein content, and everything is similar, the one thing that formula will never be able to replicate are those antibodies that are specific to that family, to that household. So it's like you have your own antibiotic ready to go at a heartbeat's notice. And that's one of the truly wonderful things about breastfeeding. Now, another thing about breastfeeding has to do with the positioning itself. And there's lots of different ways that women can breastfeed. I was very fortunate approximately 15 years ago to take a course from Dr. Jack Newman, who's considered the breastfeeding guru of Canada. During the lecture that he was giving, and he said to me, like, who are you and why are you here? And I said, why are you asking? He said, well, first of all, I never get guys who come to my lecture in the first place, and I see that you're a doctor, and I actually rarely even get physicians who come. Mostly it's nurses and it's midwives, but I don't really get doctors. And I explained to him that I was into natural medicine. At the time, I was the medical liaison for the Palm Beach County's breastfeeding task force, and this was just an absolute passion of mine. He said, come up during the next intermission, and I will show you what I call breastfeeding for dummies. I said, well, that's good. And he said to me, if you show women this one position, you'll never have any problems with breastfeeding. I thought that was a pretty strong statement, but I'm like, hey, I'm always willing to learn. And what he said is that the way that women are usually taught to breastfeed is really not helpful to their taking into account the physiology and the anatomy of how a baby's mouth is. Now, most people will breastfeed their baby this way. And what it does is that the forearm, if the baby's nursing over here, kind of presses the baby's head in. However, we know that when the roof of the baby's mouth is stimulated, that it stimulates the suck reflex. So in fact, if you take your finger and rub on the inside of the roof of the baby's mouth, the baby will start sucking on your finger. So if the head is rotated this way, you're actually driving the nipple straight into the tongue. When the head is rotated back, it drives it straight into the roof of the mouth and it stimulates that suck reflex. Secondly, the collecting ducts for the milk are on the bottom part of the breast. So if this is the bottom part of the breast, when the head is rotated this way and the baby comes in, the baby is actually able to get more of the lower jaw onto the lower part of the breast. And so we actually encourage women that their latch should be in such a way that the upper lip should just barely be off of the nipple onto the areola, but the lower lip may even have all areola and a little skin. And then that way, it's more of those collecting ducts can get into the baby's mouth to drain. Now also, when the head is rotated back, in a normal situation, if the baby's not rotated back, this is how the baby's mouth comes onto the breast. And when the baby's sucking, the baby's kind of doing like this. When the head is rotated back, this same motion, the mouth opens and closes the exact same way, but this is what's happening, and it's actually milking those milk ducts. In addition, if you think about it, 8, 10, 12 times a day, would you rather have somebody plucking on a nipple, or would you rather have somebody stroking a nipple? And so this is more the way. And the nice thing also is when the head is rotated back, now the mommy and the baby can be making eye contact with each other. They can make that first bonding. When the head is in here, the baby's pretty much just staring at if their eyes are open, just staring at the breast. So what I tell people is the only thing that you remember is that if you rotate the head back, now it's not pulling the head back, but if you rotate the head back so that you can get a finger's distance between the nose and the breast, everything actually falls completely into place. So it's a rotate back and this. So a lot of things also, you can do that in what's called the football hold, and get the head back that way. You can do it, this is the crossbody football hold, this is the regular football hold, but we find actually the best way of doing it is almost with the baby straddling the lap. And by doing that, then the baby's able to get support here, so you're not going to worry about dropping the baby, of course, but then also, then that lower lip can really get underneath the breast and can get the position that way. I have had women come into my office who have had all kinds of bleeding and nipple cracking and just in a tremendous amount of pain, and I'll put them into this one position, and instantaneously, in fact, it's the most instant gratification thing that I do as a doctor, to have them walk out of the door completely different. And a lot of times, I'll even watch the mother's face while I'm doing this with her, and like normally she'll come out and she'll just kind of open her eyes, and like, what did you just do? How are you doing that? That my baby is not hurting now. Like, it's about anatomy and physiology, and that's all it is. So it's a wonderful technique that I've learned. I've been helping scores of women with this throughout the years. If it was up to me, every woman would be taught this approach, and we would probably spare a lot of problems that women have with breastfeeding, would have more breastfeeding babies.